There we go. So again, we're so happy to have the chance to speak and to be together tonight to talk on a topic that's incredibly near and dear to, I know, all of us on this call and all of you that have the chance to join us tonight. But Dr. Bowen and I are excited to discuss some of the neurodevelopmental care practices here at Children's, really the kind of the main goals that we have for our programming that we're excitedly really expanding upon. So we'll start to dig in. So we do know that there is some degree of heightened risk for developmental differences when we're dealing with congenital heart defects. And ultimately, I think the most important thing to keep in mind is that each, and that we do in our clinical practice, is that each child is so incredibly different and has such individual experiences. Each defect is unique and is part of kind of this conceptualization, but each child's journey in itself is incredibly unique. And that's something that kind of guides all of our neurodevelopmental care practices that we institute at Children's. But we do know that during the pregnancy that, the heart is forming first. So throughout the pregnancy, the blood flow to the brain can be different and even after birth, potentially impacting brain development. And Dr. Panigrahi will go into that a bit more in depth in his discussion. There have been studies that have found that the brains of children with some forms of CHD are less mature at birth. And ultimately other factors like long hospital stays or other complications such as your baby coming early, genetic factors, neurological conditions, or insults that may happen during the hospitalization can also play into that kind of level of risk. So they're all things that we consider as we're kind of moving through the neurodevelopmental course.
So you may ask a pretty simple question of, does my child need neurodevelopmental follow-up, or why do we recommend neurodevelopmental follow-up? And while we know that children with CHD are incredibly resilient, they go through often multiple surgeries, long hospitalizations, and very often go on to have very full and meaningful lives. At the same time, there is this higher risk of developmental differences or developmental challenges. And we know that children tend to do best when we recognize these developmental delays or learning differences early, and we can then address or intervene early as well. That said, while early is optimal, it's really never too late for an evaluation or for intervention for your child. So really, an evaluation at any point during development is better than not being seen at all. It's also important to note that we see changes over time. So a child who may do very well in the early years and where we don't really see a lot of problems, they may start to show some more problems as they get a little bit older and things become more complex that they have to deal with, or if their differences are kind of subtle as things get a little bit more challenging in school and in managing everyday life, we might start to see more problems in the later school years. So it's important and helpful to look at how children are doing over their childhood, over time. For those reasons, a few years ago, or so it's probably going to be several years ago now, the American Heart Association and the American Academy of Pediatrics did issue a recommendation that routine neurodevelopmental assessment be conducted throughout childhood for all children with complex CHD. And so we do see this as an important part of your child's cardiac care. So being able to sort of really monitor them over time to help them to thrive and really do have the best outcome that they can have.
So I'm guessing we have a range of ages, those, still experiencing their pregnancy and kind of moving upwards in age ranges with us tonight. So I find it to be helpful to really think about the important milestones at different time points. And then also just have in mind kind of areas to keep an eye on and to pay attention to as your child's navigating these different periods of development in the first, I'll speak on the first years of life as I often will be covering and working with families through that early childhood period. And then I'll hand it over to Dr. Bowen as the neuropsychological care that she provides often kind of begins closer to school age. So in the first 6 months of life, we're really thinking about increasing that head control, fine motor development in terms of reaching towards objects and engaging with toys with their hands. Their communication skills kind of emerging with cooing and laughing and smiling and those reciprocal interactions, and developing sleep and eating patterns, which is easier said than done when your child's starting with us in the hospital setting, where day and night sometimes look all too similar. So things to kind of look out for are here as well. So sometimes tummy time can be a really difficult position for our kids after cardiac surgery. There can be differences in muscle tone and muscle strength, or preferences for looking one direction more than the other. I'm sure many of you can think back to those first 6 months and recall some of these things being relevant for your little one. But ultimately, the way that we engage with objects with fine motor development and the way that we traverse our environment in terms of gross motor skills is incredibly important for cognitive development too. So really in that first 6 months and even year, we think a lot about motor development for the child with CHD in terms of what we're kind of keeping an eye on the most. From 6 to 12 months, we start to see sitting up and supporting weight through their feet, grabbing and reaching for objects more readily and persistently, maybe grabbing more than one toy at a time. And that level of engagement with their caregivers certainly kind of really expands exponentially, really. So when in some cases that weakness or tightness of muscles can be persistent from those early periods, sometimes fine motor skills can be somewhat delayed. We think about, are those reciprocal interactions occurring? And in the context of that, are there any hearing or vision problems that might be playing into the way that they're engaging with others and engaging with their environment? So in the first year, those are the things that are kind of most relevant to us. As we move into 1 to 2 years of age, your child's starting to move all around and ambulating, eating is with their hands, potentially with utensils. And we know the feeding challenges that can sometimes be present. I know that was a last discussion point in terms of our Healing Hearts webinars for some of our patients. But speech and communication really is highlighted, at least in our developmental evaluations for sure, as we kind of move into these older ages. So how they're using their speech and language skills to communicate with others and communicate their wants and needs. So sometimes ambulation can take a bit longer based on the early, sometimes long hospitalizations that your child may encounter, or based on those muscle strength or tone differences that I discussed earlier. That's something to consider, as well as sometimes impaired communication skills. As you move into 2 to 3, as they're running and jumping, and fine motor development we're looking for even more mature fine motor skills. We start to think about how that coordination is impacting them at that point. Again, still looking heavily at speech in this age range, and thinking about not just the speech that their expressive communication, the words that they're formulating, but also the manner of their understanding. So their receptive communication too, as we're kind of preparing for preschool and then getting closer to that kind of 4 to 5 and eventually kindergarten age range. So, as we move into these older ages, we start to look for increased independence, self-care skills or adaptive behaviors, and also the kind of social emotional development that comes with these older ages in terms of their engagement with other children, learning of social rules, understanding of feelings, and with that emotional regulation, which can sometimes be a difficult aspect of things. So again, those are kind of some of the main points that we're focusing on in terms of assessment in the first 5 years of life. We'll go into a little bit more about our particular programming and our neurodevelopmental follow-up in those first 5 years. But I'll pass it off to Dr. Bowen to discuss some of what she's looking for as your child kind of moves into the school age time periods.
So during the school age years, what we're really thinking about, these are the years where children are really building those academic and social foundation for adulthood. And that begins, as early, as preschool, and then also into kindergarten and throughout the school years. In the early elementary years, so thinking like kindergarten to third grade or so, some of those milestones that we expect most children to achieve are things like learning just those basic academic skills, learning just to kind of keep up with schoolwork, and really thinking about forming friendships. And so some concerns that will sometimes arise during that period can be things like with those early reading skills, so learning how to sound out words or how to spell basic words. Also having trouble with learning simple math facts, and troubles sometimes with handwriting as well. So difficulty with the legibility of the handwriting, or with just forming letters and things. We also may see during these years some trouble with attention. And this, may be obvious in just in terms of sort of seeming like they're kind of in their own bubble sometimes, or sort of missing information, but you also might notice it in terms of difficulty with following multiple step directions, or seeming to kind of only get a little bit of information that you give them and then forgetting the rest. And then also concerns sometimes with making and keeping friends, which can be related to trouble picking up on sort of social cues and social rules others have, or trouble with sort of reading other children's feelings, kind of knowing like if someone's feeling sad and maybe doesn't want to be bothered, or those kinds of things. In the later elementary and middle school years, especially for later elementary, we often think of that as sort of the transition from skills like learning to read to reading to learn. You might hear it described as that. So this is when children really start to apply those basic academic skills that they learned in the early elementary years. And so we're expecting kids to start applying what they know, to have increased organization and independence. And also really starting to learn more about tolerating frustration, managing their emotions appropriately, and still kind of watching those friendships develop. And so into these years, instead of sort of those basic skills, we might see concerns with things like understanding what they're reading. So those reading comprehension difficulties. Handwriting might be messy, or you can read it, but it takes forever to take notes or to write things out, or it takes forever to type. You may also see kids putting off homework, or seeming to take longer than you think it should take, or longer than their peers seem to be taking to finish work, or seeming forgetful or disorganized. Also during this phase, we're watching out for things like changes in mood, seeming moody or emotional, getting worried often, or having a stronger reaction to frustration than you might think is typical. And also then some trouble with relating to friends, or by this point in time, not really having any like best friends or very close friendships. And then moving on into the teenage years and young adulthood, this is really when we're thinking about growing those skills for adulthood. So really starting to put some of these things in practice and becoming increasingly independent. And so what we hope to see in our teens is being able to really start to advocate for themselves, to kind of recognize what are their needs and how do you bring that up with the people that they need to bring that up with. Also being able to complete things appropriately, be it schoolwork or jobs on time, and pursuing their goals. Taking increasingly active role in their medical care, and so kind of taking more charge of what they're doing, and really focusing on really taking responsibility for good health habits and also good behavior. And so, just related to that, just concerns in terms of not asking for help when it's needed, not kind of initiating things as needed, kind of relying on their parents or being overly dependent for parents to, to do a lot of the steps that they might need to do for their own health care, would be things that we'd be looking out for then. Go ahead to the next slide. There we go. And so then just thinking about what you might see during, or what happens then during these neurodevelopmental assessments. In general, and we'll speak a little bit more to some of the specific programs that we have at CHP in a moment, but in general, the idea for these assessments is just to get a snapshot of your child's strengths and any possible weaknesses compared to other children the same age. So we just want to get that kind of snapshot of your individual child. Well, how are they doing? And we do repeated assessments over time so that we can really track those changes, allows us to see, what things are improving, and also to catch if there's any of those areas of difficulty that might emerge later on. For the infants and toddlers, a lot of it looks like play. So it's kind of, sort of play-based evaluations, some observations of the child, what they can do, what they might be struggling with, how they engage with the environment around them and also with others. When they get to the school age years and come for more of the neuropsychological evaluation, a lot of our testing is kind of like schoolwork. So we do some things that are kind of like schoolwork, but also just like a lot of one-on-one kind of puzzles and doing different tasks like remembering information and things like that. So it's a kind of a one-on-one questions and answers and those kinds of activities. We also, we want parent input throughout these years as well. So parents, we usually will have you doing some questionnaires, often also teacher questionnaires in the school years about their learning and their behavior. You know your children best, and that allows us to get a sense of how you see things at home or how teachers see things in the school, to make sure that we have context for the things that we see in our evaluations as well. And then from those evaluations, what we hope to offer back to you all are recommendations to support your child's development. In some cases, that might be early development or early intervention for the younger kids. So sort of connecting children with early intervention programs or with appropriate therapists. Sometimes we'll be recommending outpatient therapies. With a neuropsychological evaluation, I'm often recommending potential supports for school or things that might be helpful at school so that they can be considered in the school environment. So we do provide those to you so that they can be shared with the school and other people who work with your child.
So when we think about the nature of these evaluations, and we touched upon this a bit, but when we're in the hospital setting, we're really thinking about neurobehavior and kind of early self-regulatory abilities, being able to kind of get to a calm and alert state to be able to engage with your environment and to set the stage for some of these later developmental milestones that we'll assess. The first year of life, it's looking at a lot of the motor skills that I discussed earlier. Again, those self-regulatory abilities and engagement with caregivers, as well as how the whole family is doing, because there's so much going on in the first years of life and really beyond with congenital heart disease. And I think it's important to really look at the whole family system and how we can support the entirety of your family. Assessments moving in between 1.5 and 3 really expand on what we can look at in terms of cognitive and problem solving skills, communication skills, adaptive behavior, some of the things that were mentioned before. And then as we get closer to school, the school readiness starts to touch on some of the things Dr. Bone just mentioned in terms of attention and behavior and executive functioning. So this is a little taste of some of what guides our evaluation programming. So just to touch a little bit on the programming that we have here at Children's, many of you have met us for the first time in the hospital setting. So we have a lovely team, a multidisciplinary team made up of nursing and physical and occupational therapy, of child life, our research coordinators, and myself from behavioral health, and we collaborate readily with the medical teams, ultimately to optimize the neurodevelopmental environment and the supports we can offer during your child's hospitalization. So we will complete sometimes those neurobehavioral assessments that I just discussed. Your child may receive regular therapeutic services with some of the modalities I just mentioned. We work together to hopefully formulate clear neurodevelopmental plans for discharge, so that in going home and in transitioning home, you can keep up all of the great strength and growth that you've already established inpatient. And at discharge, we make sure to make the appropriate referrals for whatever services might be beneficial. Another thing I'll speak about is the weekly neurodevelopmental rounds. They've been one of my favorite parts of the programming that we've built on. We complete them weekly at your child's bedside. They've been on Thursdays at 1 p.m. as of late. But again, that multidisciplinary team comes together. And it's a great time for a discussion of your child's developmental progress, goals that we want to meet while your child's in the hospital, and how our kind of the whole staff team can collaborate and support you in meeting those goals. And sometimes in the CICU, that looks a little bit more about like what the environment is like to best support your child. And as sometimes moving up to 7A, and as things become, as your child starts to have things weaned and supports lessen, really what can we do to focus on development as you're getting ready to go home? So our hope with these rounds is to support the child and parent relationship, to optimize the environment, to improve communication between all of our teams, and to give a chance to discuss your child from a developmental perspective, and not necessarily just with that medical lens. So you'll see on the side of this kind of pyramid model that we're hoping to kind of formulate in our CICU as a way to approach care based on the medical acuity of your child in that moment. So as in some cases, for those that have been in the CICU, sometimes extra rest and kind of minimizing stimulation is what's needed in those more acute moments. But as soon as your baby tells us they're ready, we want to empower you as parents to be engaging in all of the beautiful parenting activities that you can and should be doing with your child. So I think finding that balance between medical acuity and making sure to increase stimulation and engagement as much as we can is always something that we're working on doing to kind of ease the parenting, all that you have on your shoulders in terms of parenting in a hospital setting. So kind of thinking more about the outpatient services that we have at Children's, with Dr. Johnson's help, we've started to do some visits with families on my behalf. I've been meeting with some moms during the fetal period after you may receive your diagnosis of a congenital heart defect for your child, just to talk about how processing that diagnosis has been, kind of discuss some of the neurodevelopmental elements that you may be thinking about, to talk through some of the aspects of parenting in the hospital that we want to support you through. I think it's a nice chance to start that discussion before your baby arrives. And then, as I mentioned, when in the hospital, we have a great team to serve you in terms of neurodevelopmental care practices. But even upon discharge, that care can and should and will continue. Our developmental follow-up clinic provides care through basically up to 2 to 3 years of age. In COVID times, we began doing telehealth appointments 1 to 2 months after discharge, and they've been a nice addition to check in on how the transition home from the hospital has been for you and your family. And then we hope to meet you for a kind of standardized intervals, as we discussed before, in the first year, in the second year of life, and kind of beyond for these developmental evaluations. And in these evaluations, we're looking at early problem solving skills, communication, motor skills, social, emotional, and adaptive behavior. All these domains I've talked about readily today, but it's a fun chance to see all the growth and progress that your child's making, and to kind of monitor things as we move along, and ultimately guide intervention services. And even beyond that early childhood period, services can continue. So one thing, as we've expanded and are working to expand our neurodevelopmental programming here at Children's, we're going to offer more behavioral health services through the lifespan, so that if challenges in terms of medical coping, or perhaps anxiety or mood or behavioral concerns, social emotional development, anything of that nature arise at any point, that services are available within the Heart Institute for your child. And then the neuropsychology evaluations, I'll pass to Dr. Bowen, as she'll be the primary neuropsychologist that you guys will get to work with in those older years.
So for the neuropsychological evaluations, we aim to really start those at around the entry to kindergarten. So sort of as a school readiness assessment. And so typically, if your child is younger than kindergarten, we would want to start neuropsychological testing at kindergarten. And then we continue then testing throughout those school years, like we talked before. And right now, what we're aiming to do is really see kids kindergarten, then around 3rd grade for that transition into the later elementary school years. Again, at the middle school transition. And then again at the high school transition. So right around 6th grade, and then again around 9th grade. So that's about every 2 to 3 years that we would be checking in to do an evaluation. A neuropsychological evaluation is a little different than probably a lot of the appointments that you are used to. One big difference is that kids usually come to see me for kind of a long morning, a half a day of testing. So it's usually about 3 to 4 hours of testing that we do. And that's to look at all sorts of different cognitive or thinking skills. So we get an assessment of general intellectual ability, also looking at some of those specific skills like attention, executive functioning, the speed of their processing, how their memory is, visual spatial processing, language and motor skills as well. So it's a very kind of a broad range of things that we try to cover in terms of looking at different areas. And then we'll also do typically some academic testing. And if there's concerns, sometimes we'll do a little bit more in depth in some of those areas. And again, from that evaluation, then we can identify the pattern of strengths and weaknesses that your child would have, and offer recommendations for school or other settings as well. Go ahead to the next one.
It's stuck a little bit. Let's there we go. Okay,
there it goes. So obviously, we want to take the opportunity to answer some questions today during this webinar, and we'll try to do that. But going forward, if you have questions or concerns about your child's neurodevelopment, any developmental questions, or services that we have, we invite you to please reach out to us. Probably the easiest way to reach us is at our email address, which you can see there, cardiacneurodev@chp.edu. You can reach both of us that way. It also allows us to, you can send your concerns or your questions, and then we can make sure that the right person can get back to you with any answers, either by phone, if you want to leave us your phone number, or back to you from email. So that's a good way to reach out to us. You can also reach Dr. Lorenzi quickly at her number there. And then if you're wanting to schedule a neuropsychological evaluation, then you can speak to your cardiology team so that they can put in a referral through our system within CHP. And I will say, I know that there's probably some of you out there who have been in the process or might be on our waiting list. And I want to let you know that we are finally going to be chipping away a little bit at that in the coming months. So I just joined Children's this year, and came specifically to work with cardiology and to work with the neurodevelopmental team. And so I have time dedicated to do that. So we'll hopefully be getting a lot more of your children in very soon.
I'm gonna stop our share.
Well, thank you both, Dr. Lorenzi and Dr. Bowman. You did a great job because you answered all the questions that were on the board. So I think we'll just reiterate. One family asked about how they needed a referral and they weren't able to get in until 2023. So I think those are patients we probably should have those families recall, in the next week or so to reschedule, because there will be more openings with both of you guys full-time joining us. And then just, another family asked that, how should they get a referral? So, reach out to your cardiologist. They will review your chart and put the referral in. So if families are looking for a neurodevelopmental referral, please call your cardiologist and they will put the referral in for you.
Yeah, and even though we have these time points that I talked about, so we have sort of these ideal time points that we want to make sure we're seeing children back, any time is okay to come in. So if you have a concern, it doesn't matter if you missed the kindergarten evaluation or your child's already in high school and they've never been seen before. If you have concerns or you just want us to take a look, please, bring that up and get a referral in. I would also say if you believe you have been referred and you've been told that you're on the wait list, you can also send an email to us at that email address. I have a wait list. We're pretty good, at least on neuropsychology, even though we don't ever get everybody in quickly, we do keep track and we're trying to get everybody in. So if you just want to check on the status to make sure you're on the list and let us know, then you can certainly just email us as well, so they don't have to try to call and get a new referral in. So feel free to do that as well.
Okay, thank you. And then if you're interested in the slides, I'm sure Dr. Lorenzi and Dr. Bowman are interested in, please email the perinatal email address so we know who to send it to. And then the perinatal team or perinatal cardiology team will email you back with the slides. Okay. And then we have one more speaker. I'm really excited. Our second speaker is Dr. Ashok Panagrani. He is the chief of the Department of Radiology, and he will discuss a really exciting topic of neurodevelopment, the current neurodevelopment research, and a lot of it's done here at the Children's Hospital of Pittsburgh. So Dr. Panagrani will go over the latest research and we'll open it up to questions.
Can you hear me okay? Is that better? So I thought first, I definitely want to shout out to Jennifer for putting this awesome webinar together to help our parents, which is such an important thing. It's going to probably be a little bit integrated into my talk. And I thought I would sort of start with the take-home message, which is the importance of every day. And this is the kind of thing that when parents are talking to me now after nearly 20 years of researching this particular topic, I'm starting to think that it is the importance of the everyday. And I'm hoping when I go through this, that'll make some sense. So I thought I'd go over some quick background. We know that congenital heart disease is very common, but we still don't really understand the cause of congenital heart disease for most children, even though there are some genetics, there's some other kinds of etiologies for the heart, and it's the same for the brain. There's still so much unknown. What we do know, though, over the last 30 years is that there is a shift from mortality and morbidity to survival and quality of life. And that's really what this is about. We also know that the intraoperative period, the surgeries themselves are probably not damaging the brain. And there's research now, some very good research that's been done with randomized trials that initially from 20 years ago focused on the surgical techniques. And now what we're starting to realize is that some of the etiology is probably related very early on to the fetal period and then across the lifespan. And that's what I'm going to explain and go over a little bit. There are two types of neurodevelopmental issues that we see in our CHD patients. And you heard very elegantly from Lauren and Susan a little bit about this. And I just wanted to reiterate that there's developmental disability, which is a limitation or disability of cognitive function of the brain, or the way the brain handles emotion behavior and learning. It can be a physical limitation. There's also developmental delay. And in that situation, the developmental, physical, and/or mental skills are not at the same level as other children of the same age. And so these are the two major areas of disabilities and developmental issues that we see. In this slide, we know that the severity of the heart defect does correlate with more severe deficits and spectrums of deficits. But patients who have mild congenital heart disease lesions tend to not necessarily have issues. But moderate to severe, we see quite a bit of variability of the different kinds of deficits. And I think this is why what Lauren and Susan were talking about, the surveillance, is so critical. You may not see that deficit now, but it can emerge at any time during development as you go across the lifespan. Some of them can seem very mild initially. They can also change. So I just wanted to sort of highlight that. You've already heard a little bit about the different issues that we see in our children that range from that affect their academic achievement, their language development, executive function, and also psychosocial issues, along with motor skill issues. In terms of what we know about brain development and its relationship to congenital heart disease, we do know that the brain in congenital heart disease is immature very early on in utero, and which is why we do think that part of what contributes to the abnormal development of the brain later on is probably related to the in utero period. It's one of the factors, and that's a very big area of research across the nation, multiple centers, not just ours. But we also know, and I did say that the intraoperative period didn't seem to be contributing that much. I meant that in the sense of surgical techniques themselves, but the intraoperative and the perioperative period still can contribute to a certain amount of neurodevelopmental impairment. And there's quite a bit of research also being done to really look at some of these factors. And the reason is because we can modify these. There's certain things that we can't modify, and there are things that we can. So there's a lot of interest about, for example, anesthesia during the surgery. Maybe instead of using a toxic anesthetic agent, can we use dexmedetomidine or another agent? So this is the kind of research that our field is really still very interested in. How can we optimize the surgeries to make sure that you have the best situation? We also know in the post-op period that the numbers of days that you stay in the hospital post-operatively does correlate with later outcomes later on related to the brain. And we're still trying to understand where that comes in. We also know that parental stress at some level, and this is another area of research that our field is moving into, can also contribute. And this is where there's a lot of focus now on parents and family and support. And I think that that's an area also that we're going to see more research about. This slide here just sort of extends this issue of neurodevelopmental impairment into young adulthood. And we do know that there is an escalating number of adult survivors with congenital heart disease, which is great. But we are continuing to see that these neurodevelopmental impairments are affecting their transition to independence, and that affects their quality of life. And we still see different kinds of social issues that affect their adjustment to live independently, to get jobs, and be able to have the life that you and I have. And so this research is truly, and this issue is truly a lifespan issue. There is some research also to suggest that there's early onset dementia very much later down the line. And so I just wanted to highlight that a lot of the research that we're focusing now has shifted to adults. So we are truly a lifespan sort of question. Now to show you just some examples of different kinds of studies that we are conducting here at Pittsburgh, but also as part of other multi-center studies. We're trying to tap into language development and how can we improve language development early on, especially potentially intervening in the home environment. And this is a very exciting area because we do know that it is the everyday that's probably really important for your child. And this is an area of research that we're starting. What can we do outside of the ICU? What can we do at home? How can we support parents better? How can we relate that better to different kinds of simple interventions that can improve language early on? Other areas that we're very interested is exercise. How does exercise help brain outcomes? We do have studies that are looking at cardiac outcome too, but we're also interested in figuring out how does it improve brain outcome. And we're also trying to tie the cardiac genetics, the genetics that underlie, for example, here, hypoplastic left heart syndrome, with different areas of the brain and how it affects neural circuitry. So we do know that some of the same genetic pathways that affect the heart also affect the brain. And that is a very big area for us, where we have animal models that we can go to of hypoplastic heart syndrome, even now pig models, and look at the brain and then interrelate it to what we're seeing in our patients and studying how the brain is wired. And one area that we are looking at is smell. How does smell relate to the rewiring of the brain and social outcomes? And that's one of our studies also, where we do cognitive testing, brain imaging. The cognitive testing, some of it does even overlap with some of the surveillance that we're doing as part of our clinical care. And how does it relate to smell, but also everyday factors that we see that can affect your environment at home, including sleep. And so, and this is just sort of a crazy diagram that just shows you how we can use the brain imaging to understand the circuitry related to the genetics so that we can get closer to having a much more better understanding of what is truly causing the brain to not necessarily be normal in these patients. I did want to put in a plug for the HeartCam because that is a big part of our program. I think it's a great program, and that's me DJing at HeartCamp. So I just want to end kind of with the same statement that it is the importance of the everyday, and I'm happy to take any kind of questions anytime if you have any concerns about what we know versus what we don't know. Thank you very much for allowing me to present today.
Thank you so much, Dr. Panagrani. That was fantastic. I know some of our fetal patients have participated in the fetal MRI program that you've been doing for the last over 10 years now. And we appreciate all your hard work and dedication to our patients. So let's see, for question-wise, I think we're good. I think we answered all the questions. I just wanted to end with, we are going to have another webinar next, so in October. So if people are interested, we are going to have a webinar on October 12th at 6 p.m. And Dr. Panagrani did a great job of sort of teeing us up for this one, because we will be talking about HeartCamp, the Heart Walk, the Turner Heart Picnic, and then we'll also be talking with a couple local support groups that I think, you know, as your children get older, these are the kind of support groups you can reach out to and sort of ask questions and things like that. So I think it's really, really important. We will also be sharing that link on Instagram. So if you follow us at CHP Healing Hearts, as you did for this Instagram or this webinar, we'll also have the link for that. I do have 2 questions, so let's see what they are. And there's a Q&A question. So I think overall, thank you guys so much for coming. We really appreciate your questions. If you have any questions after this webinar, just email them to the perinatal cardiology email below. We will direct them to the right physician. And thank you guys all for coming. We really appreciate it. And we hope to see you on October 12th.
you, everyone.
All right, thanks everyone. Bye.